Okay, we still have a few more people joining us, but we're going to go ahead and get started so we can use our full time here together. I am Jill Walsh. I am the Assistant Director at Prevent Child Abuse Georgia, where we really, consider anything that supports the healthy development of children and families to kind of fall under that prevention scope. So not just looking at the risk factors of abuse and neglect, but looking at those protective factors and how we can build families up as well. And we are so excited to have Amy Ard with us as an encore presentation from our 2023 conference that we had. She was able to present for us, and we're having her back today with some really impactful information to share. A little bit about Amy. So Amy Ard is the founding executive director of Motherhood Beyond Bars, a nonprofit that serves incarcerated pregnant women and their infants. So Motherhood Beyond Bars provides really a holistic family support with the goal of ending cycles of incarceration in families, and is the only organization in Georgia that is supporting pregnant women in custody and also conducting some vital research on the impacts of maternal incarceration and the impacts on their families. So I'm going to go ahead and hand it over to Amy. Feel free to put any questions in the chat box and I'll hand it over.
Thank you so much, Jill. I want to check my sound. Jill, just a thumbs up. I can see you on my screen. Great. I am really happy to be here today. I liked Jill's question or comment on like putting your state in the meeting chat. Maybe like state of mind would also be helpful. I'm coming to you as a whole person this morning. When I said I would do this presentation today, my mother had not yet scheduled her total knee replacement, which was yesterday at this time. And I'm very happy she came home. And when I told her, right after surgery, when I told her I was doing this at 10 a.m. that morning, she suggested maybe I just go into the office and do that and leave her at home by herself. And then she said, no, I'll be fine. And I said, I am not going to go on a Prevent Child Abuse Georgia webinar and have a woman screaming for help in the room next to me. So like I just want to say my state of mind, I'm able to be present with you because I convinced my mom to bring bagels and coffee over. And so she is sitting in the next room. But if there is an issue, I will be called to help. Just wanted to come to you as a whole person today. And also, whenever I do conversations like this, I'm always really mindful about who I'm bringing with me. Most of the women that we work with, most of the children that we work with, and most of the caregivers that we work with often feel pretty invisible. And the women that we work with are invisible almost on purpose. We put them behind a wall, we put them behind concertina wire, and we have very few opportunities to peek behind that curtain. And so I try to bring some of them with me. And I usually do that when I'm in person. I bring them in the form of an origami heart. This is the logo for our organization. And there's a really cool story, I think, behind these. But every time I speak, I bring someone with me. This morning, I got a phone call from one of our oldest friends in the program. Her name is Drew. And often she comes and speaks with me at events because she is now formerly incarcerated. And her story is so powerful. And so I want to share a little bit of that with you today as a way of bringing my friends here with me today. Drew was incarcerated. She was pregnant, had a baby while she was in prison, and originally was thinking about having her baby put up for adoption. And because that was what her thinking was, the nurses at the hospital, when she had her baby, said there was very little point in her being with her baby. So she had 2 hours with her child after birth before they were separated. And in that 2 hours, Drew fell in love and decided that she could not have her baby put up for adoption, never seeing her child again. And in fact, the father of the child was very interested in being involved in the child's life. But because this process had started, she wasn't able just to say to the father, come get the baby. The baby was in the child welfare system. The father then had to work for over a year to regain and has gained full custodial rights of his child. Drew also had 2 older children who were with their father when she was arrested. Her crimes that she had committed were 6 years old when the knock came at her door. the demons that she had been struggling with, addiction, she had been dealing with. But when the knock came on her door, she had two older children that then lived with their father. Their father was still struggling with addiction, and they were living in a hotel. We spent time with them, making sure that they had clothing that they needed and Christmas presents. And then at one point, the father was behind the wheel of a car and ran into a bus in front of one of the children's schools. Defects was called and the children were removed. At this point, Drew was closer to the end of her sentence. She was in a transitional facility, and so she was able to have communication with Defects case managers. This would have been very different had she not been in a transitional center. She would have had no access to a phone in order to call them whenever she needed an update or whenever they needed information. And so she quickly was determined that when she got out, she would regain custody of her children. And this process proved to be very, very difficult for a woman who was incarcerated. She worked her entire case plan from the transition center. She enrolled in college. We were instrumental in that process. And she was able to maintain a communication with her children, again, because she was in a transitional center and not the prison. And so when she got out, she had supervised visitation, and which led to unsupervised visitation. There was one piece that she needed, which was a place to live. It turns out that finding a place to live, if you have a criminal record, is very difficult. And she didn't need just any place to live. She needed a place she was looking to keep her kids in the same school system that had been very supportive of them. Her children had 6 placements in the foster care system within a year and a half that they had been in there. So they were moved around quite a bit. She was interested in providing a lot of stability, and finding housing was hard. And one afternoon she called me and she said, "I think I have to buy a house." And I said, "Well, please tell me more." She said, "I can't find anyone that will rent to me. I have to have a 2-bedroom house. I know that the community that I want to live in, and I found a place that I can afford the monthly payments, but I need a down payment." And so I made a call to my board executive director. I told her there would be a $1,000 cash, not opposite of deposit, withdrawal from our bank account. And I handed Drew a envelope with $1,000 in it the day before she closed on a house. She became a homeowner, and 6 months later, I was able to be in the courtroom with her when the judge closed her case and told her her children would be home for good that night, and they were. And I think about Drew's story. She's not a unicorn, although we sometimes think that these stories there are unicorns out there and that Drew is uniquely capable of doing what she did. There are a lot of women in prison who are capable of having Drew's story, but the support that has to come together at exactly the right time in exactly the right place is what's lacking for a lot of these women. And I am motivated every day to do the work that Motherhood Beyond Bars does, because I believe she's not a unicorn, and that with the right support, a lot more women and a lot more families could be whole if they had that support. So that's who I bring with me today. That's a longer story than most people's story. But she called me about 15 minutes ago, and oh my gosh, she is just, she's got an amazing job. She keeps getting promoted. She was inviting me to an event on Sunday where she's speaking. It's just remarkable. I'm going to turn over to the slides now to situate our work in a little bit of a broader context. There has been an 800% increase in the number of women who are incarcerated in this country over the last 4 decades. We've heard stories, there are news reports about the incarceration rate going down in the United States. That is something to celebrate. But unfortunately, that's true for men and not for women. We are seeing the incarceration rates go up. There are about 210,000 women behind bars, and we actually have no idea how many of them are pregnant. The ACLU suggests that there are about 12,000 pregnant women. Some researchers have said that about 4% of women coming into jails are pregnant when they get there. One of the problems with our work is that if we can't identify how big the problem is, we don't know how many resources we need to solve it. And in the state of Georgia, we have no data collection on the number of pregnant women in jails. So this becomes problematic because the majority, slim majority of women who are held in carceral facilities are held in jails. So if they're coming in pregnant and there's no way for us to identify how many pregnant women are in our 159 county jails, then we don't know the scope of the problem. We do know, and this is in the United States, that another large chunk of women are in our state prison systems. And on this slide, you can see a little bit about how they get there, but also the number of women in jails who have not yet stood in front of a judge or jury for their crime is also a troubling factor for us. In the Georgia prison system, we do keep track of the number of pregnant women in our jails. If you were to go online and do inmate profile under the Georgia Department of Corrections website, you would find a monthly report of who is held in our prisons. This is an older report. You can see at this month, there were counted 28 pregnant women. I don't know much about that one pregnant male, although he has been counted in the past repeatedly. It does bring up a question about how much we can trust the data that gets put in front of us when issues like this come up a good bit. On average, I would say there are about 50 women in the Georgia prison system that give birth every year. We saw that number go down during COVID. It is starting to rise back up again, and we're a little concerned that we're going to be looking at more closer to 70 to 80 pregnant women in the upcoming year. These numbers really are starting to rise up again. I think as a side effect of the court systems being pretty well lubricated, getting up and running again, we are seeing women move faster through the jail to the prison system. There are some differences between men and women in our prison system. And one of those big differences in the literature and the research shows that women who come into the prison system are 90% of them are self-identified as victims of violence with traumatic histories. So this chart shows that 81.91% of women coming into the prison system were receiving outpatient, at the very least, mental health treatment when they came in. That doesn't always mean that they get that same mental health treatment once they enter the prison system. Our prisons are, the staffing levels are very low, and it can be very difficult for women to receive consistent mental health supports when they're in prison. I will tell you that Drew, who I brought with me to this meeting today, she was there for 4 years and never had a mental health appointment. So it is not unusual that people, and this is for someone who gave birth while she was in prison and was separated 2 hours after birth. This is a person that has mental health needs, physiologically would almost be guaranteed to have postpartum depression, and received no mental health counseling for the 4 years, even as her children entered the foster care system and they were separated. And that is a problem because we are counting on women to go into the prison system. We call it the Department of Corrections. We're hoping for rehabilitation. And often what we get out are women who are more traumatized, who have had experiences that require even more intense mental health counseling on the other side. It's not a good investment of taxpayers' money to send someone into prison when they come out worse on the other end. And we're seeing that over and over again, not just with women, but also with men. We know and did know, I should change this slide. We know a fair amount now about almost nothing about what happens to infants when they are born to women in prison. And that's true across the United States. There are about 7, I believe, prison nursery programs in the United States where women give birth and are not separated from their infants and are able to live together for a short period of time, usually just up to 18 months or 2 years in prison. Those programs are very few and far between. For almost every woman giving birth in a prison system, they are looking at fairly immediate separation from their newborn. Now, we don't know a whole lot about the long-term effects of being born to someone in prison, but we do know that every single child born to someone in prison is born with one adverse childhood experience already on the checkbox. That is one of the qualifying factors for an ACE, is that you have a close family member that's incarcerated. Every single one of our infants takes their very first breath with that ACE already marked off, and then they tend to pile up more along the way. And so that we know by the time children get to school, We see some behavioral we notice through their behavior that there's some issues. They have more mental health diagnosis. They have the school to prison pipeline is already being well greased for them. There is some research that shows that if you were born a woman in prison, you are more likely to end up there yourself. So how many children does this affect? Well, 80% of women in our jails in the United States are mothers to dependent children. And if 4% of the women coming into prison are pregnant, that's a whole lot of babies. 10 million children have had a parent who is behind bars in their childhood, and over 2.7 million children have had a parent in jail or prison. And what this means statistically is that there is one child in every single classroom in the United States that has experienced separation because their parent is in prison. And I started this day talking about my mom, who was an educator her whole life. And she worked in Atlanta. She worked at an APS school that was right on Northside Drive, which is where now it's in the shadow of Mercedes-Benz. And she was a reading specialist. So that means that when you're not a classroom teacher, you often get assigned other jobs. And she was assigned as one of the playground aides. And she told me long before I got into this work that on Northside Drive, when the white prison buses rolled down the street, there would be children that raced to the fence of the playground to wave at those prison buses going by, hoping that they would have a family member that would see them and notice them. And I can't think of a much more heartbreaking scene that my mom witnessed day after day as those white buses rolled down Northside Drive. Those children are sitting in classrooms with every other child. And if they show up with all of the issues that we believe that they have in elementary school, their behavior affects and their trauma affects everyone else around them. So this is an issue that if we care about children, we should care about some of our most vulnerable ones. And I make the argument that these children are among the most vulnerable in the United States. And one of the reasons that's true is because when women go to prison, they lack the same social safety net that some of the men do. And studies show that when a woman is arrested, if she has young children, those children are 5 times more likely to end up in foster care than when the father is arrested. And that is generally because around that man, there is often a community of women standing by, ready to provide some semblance of safety and security for the family that he leaves behind. That is not true for women. They are really lucky if there is one person on the outside who is willing to take care of their children in their absence. So women enter the prison system isolated, and the situation gets worse from there. They enter a system that is really designed for men, not women. We didn't build prisons thinking about women, and we certainly didn't build prisons thinking about pregnant women. In the state of Georgia, I think we do a good job of providing services to pregnant women. And one of the reasons I think it's good is that women are in one facility. It's called Helms, and it's inside the city of Atlanta, and it's a medical facility, and it's a small facility. So people don't get lost. They don't fall through the cracks. There are nurses that are on staff there all the time. And that's where every pregnant woman in the state prison system, again, I'm not talking about the jails, which is where we think the majority of pregnant women are. These are women who are post-sentencing. Judge or jury have said, yep, you've got to spend some time away. They go to Helms and they receive their prenatal care there, and then they go to a hospital to deliver their baby. Last year was a rough year because where they used to go was Atlanta Medical Center, and that hospital shut down in November of 2022. And they are now at a different hospital. They had at Atlanta Medical Center until pretty recently that 2 hours after birth with their baby before they were separated. And moms went to what they called the inmate floor, and the babies went to the NICU. At the new hospital, there is no inmate floor. Moms and babies spend sometimes 24, 48 hours until she is released medically. They spend that time together. And then the babies go to the nursery and the moms go back to prison. Now, they do not go back to the small facility where they were held when they were pregnant. They go to Lee Arundel State Prison, which is right now the largest women's prison in the state, although slated for closure at some point. And they enter a very different experience of incarceration there, where Helms was very small and they had a lot of medical attention. Lee Arundel is a large prison, and it is easier to fall through the cracks. They don't have the same access to programming right away. They don't have the same access to phones and to emails, just to stay in touch with their family members. So these moms and babies have very limited opportunity to attachment right after birth, no opportunity to breastfeed. There's no milk cessation support in the Department of Corrections. She's really up to her own devices to figure out how to make that manageable. The babies don't have access to breast milk. And then someone needs to come pick up the baby at the hospital. And one of the, I think most common misconceptions is that these children enter the foster care system from birth. Nothing could be further from the truth. Most of these babies are picked up at the hospital by a family member or a friend. And this is how the mechanism of that works. I think there are a lot of issues with this and worth addressing. So this is an old form when Atlanta Medical Center was the hospital where babies were born. This is what moms fill out when they are still pregnant and in the prison. They say the name and the address and the phone number and the relationship between them and the person they've identified to pick up the baby. This gets notarized at the prison at Helms and then goes with the mom to the hospital. This is a hospital release form. It is a document that releases the hospital from liability, but this has absolutely no standing in a court when it comes to guardianship or power of attorney. That's not what this is. This is the only thing that most caregivers walk away with. And I'm being told by our staff now they don't even walk away with this. This is just it's digitized now, so they don't have a copy of this. When the mom has left the hospital after giving birth, usually 48 hours, the hospital opens their folder and finds this piece of paper and calls the number on this piece of paper and tells them there is a baby to pick up. Now, this was the story that I was told for years and years when I worked in Lee Arundel with the postpartum support group. And I was shocked that there wasn't more communication, that there wasn't anyone reaching out to the caregivers. And so then I went to talk to the hospital and I said, tell me about this piece of paper that you use to send the babies home. And they showed me this piece of paper and said, and we make that phone call. And sometimes those people don't know what we're talking about. They didn't know they were going to be a caregiver. We tell them they've got 4 hours to get here and they need a car seat when they come. And so we know that they are scrambling to make this work. And when they get here, we make sure they watch a couple of safety videos and then we send them out the door. And I said, well, who picks up with them after that? And they said, we have no idea. So I went to talk to my friends at DFACS and said, tell me about the case management that's done for these families. And they say, no, we don't have case managers for those families. And I thought that sounded great because, they didn't necessarily need that level of involvement. But then they said something interesting. They said, they don't start with us, but we're pretty sure that a fair number of them end up with us. And I got real curious about that and why that might be. And that has led us into a whole different area of programming from where we started. When we started in 2013 is really when the work of Motherhood Beyond Bars started. I didn't start that work. I just founded the nonprofit in 2018. It was at 2 facilities, Helms and Lee Arundel State Prison. And we did prenatal education, postpartum support groups, prenatal yoga, and baby showers. What we were doing was really centering the identity of mother for women who are often called by a number, and if they are lucky, a last name. But very, very few people are reminded once they're in prison that there is someone on the outside of those prison walls waiting for them. And we worked hard to prepare them to leave prison and parent with confidence, both with education about what a healthy pregnancy could look like, even if you're incarcerated and can't choose what foods you want to eat or how often you exercise, to the postpartum period where you can't necessarily get postpartum support for either mental or physical health concerns. And what we imagined was that if we did this the right way and we gave women the confidence that they needed to leave prison, that this is what we would find on the outside, that a mom would leave prison, her child would like just run into her arms, and that would be the last time anyone in that family ever saw the inside of a prison wall again. And then one day I was talking in our postpartum support group to a group of 14 women. And it was right after Halloween. It was in early November. And we started our class in sitting in a circle every day. And I noticed I was able to bring in some Halloween candy that day, and that there was a woman who was taking all of the candy wrappers and folding them, not unlike our origami heart. When I think back about like the importance of folding stuff in our program, we fold a lot of stuff. And she had just tears running down her face, and it got her turn to talk. And I said, I can see that something's really bothering you today. And she said, well, it's my baby's birthday this week and I won't be there. And I said, well, tell me more about that. And she said, well, when I was little, I had a bracelet that I wore on my birthday, and my mom sent it to me, and it was made out of candy wrappers. And I'm making that bracelet for my baby so he has a way to remember me. And I said, well, where was your mom? And she said, oh, she was in prison. And I took a beat, and then I asked this group of 14 women, I said, how many of you had a parent in prison growing up? And 13 hands went up, 13 out of 14. I tell that story. And I also, Drew was in the class that day. She was the one whose hand did not go up. So she was a bit of a unicorn in that sense. And I realized that I was sitting in a visual representation of a cycle of incarceration. So each one of these women had missed someone because of incarceration, and they had just given birth to the next generation. And so whatever I thought that we were doing in there was probably not enough to break that cycle. We needed to go deep. And I began to hear things from the women themselves that just started to worry me. Most of the time when they got in our postpartum class, they were so excited that someone came to pick up their baby at the hospital. Their mom, most often it's a grandmother of the child that comes to the hospital to pick them up. My friend, my cousin, my sister-in-law, as you saw on that last piece of paper. And sometimes those relationships are completely made up, which we have learned to question. So sometimes when it says sister-in-law, what it really is was your bunkmate from county jail. That's who you can write. You could write your mailman's name down on that list. That's who the hospital would have to give the baby to. But as grateful as they were when the baby went home from the hospital with someone, about 6 months later, almost like clockwork, we would begin to hear things like, that woman's not taking care of my baby. She didn't tell me anything about my baby. Every time I call home, the baby is screaming in the background and has diaper rash, and she's not changing the baby's diaper. Those conversations between the mom and the caregiver started to get very strained over time. And then the caregivers and the mom started to drift apart. And then the baby started getting moved. So this woman's not taking care of my baby. I'm going to give my baby to someone else. And off the baby would be changing hands far more frequently than we thought it was safe or good for babies to change hands. And so the relationship between the mom and the caregiver was fraying, was dissolving. And we also knew the closer the mom got to being released from prison, the less resources and options she had, because those bridges were being burned on the outside. When that baby got picked up by the other person, caregiver never wanted to see that mom again. She was ungrateful. She wasn't doing the right thing. And so moms were asking us for two things. They were saying, please help take care of my baby, because obviously I cannot send money home from here. And the caregivers are really struggling. My mom doesn't have enough money to buy diapers, and my mom can't go to work if she's also got to stay home with the baby and there's no childcare. And the caregivers were saying that mom is not grateful at all. And she sure can't come live with me. And she's got to clean up her act before you even let her see this child again. And that thread was getting more tenuous and more tenuous. So the moms were asking us for two things: help take care of my baby and help me when I get out of here, reestablish relationships with the people in my family and my children. And we couldn't do those two things when we were in-person volunteers in a prison. We were not allowed to have contact with family members on the outside, and we weren't supposed to have a program that worked with women inside once they came out. These rules were hard to find written down, but they were repeated again and again to me. And so we started to think about what the women had asked us for, and we started to explore. We had those conversations with the hospital and with DFACS. And I quickly came to the conclusion, and at this point, Motherhood Beyond Bars was a team of one, that I knew more about these infants because I was talking to their moms than anyone else in the state. No one could tell me where they lived, what kind of resources were available to them. It was it. I was talking to the moms. I knew that there was a woman that had twins, whose twins were handed to basically a stranger from a coffee shop because the woman that came to pick up the babies at the hospital, the aunt, was not able to care for them. I knew that babies were changing hands in the parking lot of Atlanta Medical Center because whoever came to pick up the baby couldn't make it to work the next day, and so brought someone else with her that was planning on taking care of the baby. And no one else could tell me anything about them. And I realized that we knew enough to know that these infants were at high risk. We knew enough to know that by the time they got into elementary school, they had some severe developmental issues tied to the incarceration of a parent, but we were not reaching them before that moment. And so when the women were saying, please help take care of the baby, they were right. These infants needed additional help, and so did their caregivers. And so when we started our program, we started working directly with Atlanta Medical Center to make sure that every child that left the hospital with a caregiver left what they needed to safely take care of a newborn. So these are called our begin boxes. It was a safe place for the baby to sleep, mattress inside the box, and it had about $300 worth of newborn supplies, everything from diapers and formula to clothing, to infant safety kits, that little fingernail clippers and shampoo, and things that weren't safety related, like books and Snugglies and information about safe sleep. And so every caregiver that came to the hospital walked away with one of those. And importantly, they walked away with a promise that they would never buy a pack of diapers for that baby. And they weren't going to have to go to a diaper bank to get the diapers. They were going to get diapers that would last them for a month, and that they would arrive on their doorstep like clockwork. When the moms told us that one of the main reasons they wanted to move their child was because when they called home, they heard a baby crying with diaper rash, the caregivers were telling us that they couldn't afford diapers. And this rang true because 1 in 3 families in the United States, and I've seen it now as 2 in 3 families in the United States, can't afford enough diapers to last for a month. Diapers are expensive. There is no social program like WIC, Women, Infants, and Children, or food stamps. You cannot use those to buy diapers. So every month, it's about $100 out of your pocket if you're doing diapers and wipes. And caregivers were telling us the strain that this put on their families was one of the reasons they picked up the phone and called DFACS and said, come pick up the baby. I can't do it anymore. So we had a family that was family, that was loving, that wanted to care for a child. The child was safe, and it came down to a financial decision. And that was shameful. That is when we said, we cannot solve every problem for these families. Breaking the cycle of incarceration in these families will be difficult, but we can solve this one. So diapers are our initial promise to the families, and it's a dangling carrot that makes sure that when we call, they answer. So a lot of these families, for very good reason, are suspicious of agencies and organizations. They all assume that someone's coming to take care of their baby or make judgments on their family. And our initial promise is, we're going to send you diapers to your doorstep every month. But what we do need to do before we do that is have a conversation with you, because we know that babies grow fast, and we don't want to send $50 worth of newborn diapers if this baby now wears size 1. And so in order to get the diapers, we have to have a conversation. And that's how we begin to build relationships of trust with the families. The smartest thing that I did on month 1 of our infant and caregiver support program was to realize I needed help. And I assumed that when we started the program, there would be about 2 babies born every month. And I thought, well, that's a manageable number. I can keep up with those families. I can build relationships. And then month 1, 5 babies were born. And I lost my mind a little bit. And in the way that there's a lot of magic at Motherhood Beyond Bars, a friend of mine who had worked inside a prison as a volunteer told me there was a woman I really needed to know who had just been released a few months earlier. And her name was Vanessa. And she had written a business plan for a nonprofit that focused on keeping families connected and unified during the mother's incarceration. And that was because she was a mother who was incarcerated. Her youngest child was 1 and her other child was 10 when she was sentenced to prison for 9 years. And when she came out on the other side, she had met so many other women whose lives were being destroyed by separation, because of separation from their children, that she was determined to do something about it. So we met on a Saturday in March, I believe. And on Monday morning, she was my employee number 2 of Motherhood Beyond Bars. And so we quickly started building an organization and a team that could respond to the number of children being born in the system. As of today, there are about 169 infants in our program, just the infant and caregiver support program. We also pay for all of the communication between caregivers and mothers. So it often surprises people that every form of communication from prison costs money. So when I was talking to the moms and they told me, I don't even know if someone's come to pick up my baby at the hospital, the amount of stress that was causing them, the amount of panic that was causing was shocking. And it was shocking because that's just a phone call, except they didn't have a way to pay for it. And the families didn't have money to put on their account. This is a screenshot from what it costs to send an email. Every email costs 35 cents. And if you want a response, you also have to pay for the 35 cents. So a phone call is about $2.60 for a 20-minute phone call. And there's a service charge. And I take this opportunity, most times I'm telling this story, to point out that being poor in the United States is very, very expensive. So if you have $5 extra to spend and you want to make a phone call, it's going to take that whole $5 to make one phone call. Because if you don't have $20 to put on your account, you only have $5 at a time, you have to pay that service fee every single time. So what turns out to be a 20-minute phone call can end up costing $5 over and over again if you don't have the extra income to make one lump sum payment and only pay that service fee once. And so we do that. We do that for all of our caregivers. We put $30 on their account every single month so that they can stay in touch with the incarcerated mom. They can give updates from doctor's visits. They can co-parent. They can offer ideas. They can just tell the mom, hey, your baby giggled today. That information is like gold. It's a form of connection. We know that we cannot create a connection between a newborn and a mom that they can't see or taste or touch, but we can keep moms feeling connected to the newborn, and we can create attachment between the newborn and the caregiver that will more easily slide over to attachment between the infant and the mom when she comes home. And that is the price of communication. That is why that $30 a month builds the possibilities of those relationships down the line. We spend a lot of time building relationships. Usually when the families that we talk to, when we ask them or people ask them, what is the most important thing about Motherhood Beyond Bars? Yep, diapers come up, but also they talk about friendship. They talk about having someone who understands what they're going through, who is solving problems for them locally, connecting them to local resources, keeping them connected, facilitating relationships. One of the questions that we ask on a survey is like, do you have a counselor or a friend that you talk to about this issue? And almost always what they say is, yep, Vanessa, yep, Sarah, it's one of us. And we realize that we are a fundamental connection between the caregivers and systems and agencies and organizations that can help them make it through this difficult journey. We also begin planning for reentry from the minute we find out that a woman has entered the prison system. And that's important. I'll talk more a little bit about our research in a minute and how long these women are incarcerated in general. But the quick answer is a lot of these moms are coming out soon. A third of them are coming out within 6 months of delivering their child. So we need to start on reentry planning from the minute we find out they are there and still pregnant. And so our infant caregiver program, we named it that to begin with. And then we had a reentry and reunification program. And within like a week, Vanessa, who I had hired to really do the reentry and reunification program, said, this is crazy. They're a family. We have to serve them as a family. So we have the infant, we have the caregiver, and we have the mom. And that is like the holistic family support that's required to provide the safety net for the entire family. For a long time, we thought of ourselves as a criminal legal system organization, providing services inside the prison to women impacted by the criminal legal system. And then we started exploring the effects of incarceration on families. And I started attending more child welfare conferences and quickly realized we were also really working on foster care prevention and support for some of the most vulnerable children in Georgia. And so we found ourselves at this intersection of the criminal legal system and the child welfare system and realized we were kind of lonely in that spot because there weren't very many organizations that were providing sources to the youngest children affected by the criminal justice system and also the women inside. And so we decided that because we were alone in that space, we also had an opportunity to educate people and to build better systems to support these families. I mentioned that I did not start the work of Motherhood Beyond Bars. That was started by a woman named Bethany Kotler, who graduated from Rollins School of Public Health here in Atlanta. And when I moved to Georgia, which was in 2017, I moved here. And this is how I got into this work. I was a childbirth doula for 10 years and really loved watching babies be born. I'm from Atlanta. I grew up here, but two of my three children, actually the middle one was born in Atlanta. The other two were born in Washington, D.C. And I helped people have babies. I was working at a downtown D.C. hospital one day. I was usually hired directly by families and I was pretty expensive. It was not a cheap doula because it's a hard life. And I was walking out of the room to get some ice chips from my client in a DC hospital. And I walked out and there was a gurney in the hallway with a pair of handcuffs hanging off the side of it. And it was an image that I'd never seen anything like it. It was very incongruous with what I believed should be happening on the labor and delivery floor. And as I was staring at that, the room next to the room I was working in opened up the door and an armed guard walked out. And it occurred to me that the handcuffs that had been on that woman on the gurney when she got brought in were probably on her in a bed in the room next to mine. And that there was a woman chained to a bed trying to have a baby. And my world turned upside down that day. And I started exploring where it was legal to shackle women in the United States. And my home state of Georgia was on that list. And I figured I knew more people here. I was better connected here. I am sitting in the house that I was born in with my mom. My dad had passed away, and my mom was desperate to have her 3 grandchildren, her son-in-law and daughter move back in. And so we came back to Georgia to do the work that we felt called to do. I got here not knowing much other than I wanted to be a doula and I wanted to get shackles off of women. And I am happy to say that in 2018, Georgia passed anti-shackling legislation known as House Bill 345 that prevents the shackling of pregnant second, third trimester women in labor and 6 weeks postpartum, whether they are in prison or in county jail. So it's no longer legal in Georgia to do that. And I met a woman named Bethany Kotler in the process of doing that legislation that had started a childbirth class in a Georgia prison. And the name of that class was Motherhood Beyond Bars. And the women had named that class. So I was working on the legislation, very interested in the doula work. And I took her out to lunch and said, oh, this class is amazing. I read about it and on NPR. And she said, yeah, it's been, I graduated from Rollins. I've kept doing the class. Also, I'm moving to Boston in a month, and I'm pretty sure the whole thing will fall apart. And so I was kind of between bites of my salad at that point. And I said, well, if you give me the name Motherhood Beyond Bars, I will really try to take good care of it. And that is the day that I became the unpaid executive director of a nonprofit that was not formed yet. So Bethany started the work. And the reason she was moving to Boston was to begin her PhD at Harvard T.H. Chan School of Public Health. And she got there, sailed through coursework. Oh, she'd probably not say sail, but she's super smart. And started talking to people at Harvard about Motherhood Beyond Bars and the fact that we were getting ready to start a program that reached every infant born out of the Georgia prison system. And some people there who did research on highly vulnerable infants and families said, we have a real opportunity here to understand what the impacts of incarceration are on infants, something that no one has ever studied before. And so when we began our program in 2020, our infant caregiver support program, we also began research with Harvard School of Public Health. And this research is now about 3 years old. We are studying the unique experiences of incarceration on that family, that triad. So mothers, infants, and caregivers. And we are looking at the strains of raising a child for that caregiver, the financial burden of caring for the children. We are looking at the exposure of ACEs on those infants, so adverse conditions in utero, early separation, and exposure to household risk factors. And then we're also looking at the effects on the moms, so the stress of incarceration, lack of adequate healthcare, and early separation of infants. And we do that because there is a lack of research on this issue at all. There have only been 2 retrospective studies that have attempted to characterize caregiving. So when a mom is incarcerated, what the characteristics of caregiving are. And both of those studies have had a point in time and have been asking people to think back into the past to tell us what that was like. There have never been any studies that did it in the moment. And no prospective assessment of health outcomes on this population. So this is a really, really unique study because we get people from the moment of birth and then we follow them for 3 years. And it is a co-designed, co-led, worked out program. The people doing the research are Motherhood Beyond Bars staff. So we're not asking people to go into focus groups or to talk to researchers they don't know. Most of them characterize our data collection as a conversation with a friend. And we are using the data not just to shine a light on what happens to families impacted by incarceration, but to build a better program, to be responsive to the needs that come up along the research. We enroll the infants from birth, and then we enroll the mothers once they come out from prison. So we are not doing research with an incarcerated population when they're incarcerated. They have to be out of prison before we pick up the research with the moms. So while the moms are separated from their babies, we do the research with the caregiver. And then when she comes out, we do it with both the caregiver and the mom. And then we follow up every 3 months in the first year of life, 6 months in the second, and then once when the child is 3. This data, every month we have new people join our research, but at the point these slides were done, we had 64 children, 53 caregivers, 11 mothers were released before the birth of the baby, and 17 after the birth. And here are some of the key statistics or demographics. Of the children, there were 64 at that point, 53% were BIPOC, 31% Black, 21 mixed, 8% Hispanic, 39% of the babies came through C-section. That rate's very high. World Health Organization would say that that is not a number to aim for. And 15% of the children were admitted to the NICU for medical reasons. Just remember, all of our children end up in the NICU before they're picked up. 15% of them were there for medical reasons. And this is important. We used to think that just like in talking to the families, that the babies were born fine. There weren't any big medical issues. That's a much higher number than we expected for medical reasons. 56% of our caregivers are grandparents, 20% are other relatives, Only 4% of our caregivers are fathers, and 16% have no kinship relationship to the infant. And again, that might not be what it looks like when they write who they are down on that form. But as we are able to build relationships, we realize that, that sister-in-law or that cousin is really not. We have a couple of caregivers who were just formally incarcerated with the mother at some point and got out early and decided, and in conversation with the mom, that they wanted to be the caregiver. And we'll have some reasons for that in a minute. The average age is 45. So many of these grandparents are too young to qualify for grandparents raising grandchildren. And a majority had a high school education or less, 62% of our caregivers. These are risk factors for our caregivers, that 27% of them are living under the federal poverty line, 31% of them, and this is at intake, report being food insecure, and 11% are moderately to severely distressed. And I think this is understated. When you look at the Keesler scale, the kinds of questions they're asking may not get to all of the things that might distress someone who was not intending to go back and raise a newborn again. This chart, I think, shows the impacts of being a caregiver over time. So the percent of infants at each assessment period exposed to household risk factors of poverty, and these are the risk factors: poverty, distress, and food insecurity. You can see that as the child reaches that first birthday, the blue line goes way up, and this is household poverty. So the effect of having that child in the house increases the risk for poverty for that family. And a lot of people are surprised to learn that if you are a kinship caregiver, you do not receive any of the financial supports that a foster family would get. So even as nominal as those are, they're not receiving them. Food insecurity goes way up. Distress, however, we see that leveling out. And I believe, and my program staff believes, that this is a direct result of their enrollment in our program, that they have someone reaching out to them, that they feel socially connected, that they know that they have someone to call. So even if things are getting harder, just quantitatively harder for them in their household, they feel more supported, and that distress level goes down. For mothers who were released before birth, these are some of the demographics for them. 100% of them are living under the federal poverty line. So if they come out still pregnant, probably unable to find a job, 100% of them living under the federal poverty line, and 10%, which I think is a pretty low number for a situation like this, say that they are moderately or severely distressed. For women that are released after birth, demographics there, 69% of them are still living under the federal poverty line. 61% of them continue to share care with the child with that temporary caregiver. And for most, when we are doing reentry planning, what we are really aiming for is a safe landing place for that mom where she can begin the process of reunification with her child. So that 61% is what we're aiming for. We'd like it to be higher as long as that relationship is smooth and supportive for the mom and the caregiver. That's a good way for the infant and the mom to start to build a relationship and attachment in relationship with the original caregiver as well. 40% of these women were released 6 months or less after the birth of the infant, which really suggests that we have an opportunity to do something different than incarceration for these families. And I think that that is the work ahead of Motherhood Beyond Bars, is to identify alternatives to incarceration that prevent the separation of the mom and the baby whenever possible, because we can see the negative effects of that incarceration potentially through the child's life. If instead of incarcerating women, we were able to present them with a true healing experience, really a recovery program where they could be pregnant and then give birth and be with their child for a year, I think that we would start to see outcomes. I think that gets to the root causes of this intergenerational incarceration, and that instead we separate moms and babies from the moment of birth and then expect different outcomes than we've seen in the past. So the work ahead of us is preventing this in the first place with every woman that we can. And that's going to be a whole lot of pregnant women in prison because the majority of them have a substance dependency issue that would be better treated outside of a prison and in a therapeutic environment. The families are forming relationships, and we wanted to know through this research how and why they were formed and how the decision process was being made about who would care for the child. These are some of the themes that come up in our research, that there is a strong preference for family. The maternal grandparents and other maternal kin are about half of the caregiving sample, and that they're kind of the obvious choice for most women. Even in cases when the baby is cared for by a paternal relative or a friend, maternal relatives were usually considered first and then ruled out. And there's some quotes over here on the side that I think are exhibit some of the thought process behind that. Victoria, and all of these names are made up. I was like, I don't know what I'm going to do when I get to Helms. And she's like, well, I'm getting the baby. And then I was like, okay, that made me feel better. I just wanted her to stay with family, And Stephanie, so when she asked me about it, she was skeptical about her family. They have a lot of health conditions going on, and she didn't feel comfortable leaving the baby with them. And so her mom being 100% disabled, she really didn't have any family member that she would trust to, take the baby. And that was Stephanie, a caregiver. Avoiding foster care is the number one concern, not just of the moms, but also of caregivers. So when there is a choice, the moms are highly, highly motivated by her perceived ability to reunify her kid with her child when she comes out. And caregivers also reported that accepting the role to keep the child, they were accepting this role primarily to keep the child out of foster care. So what we have is a caregiver who may not be entirely thrilled to be taking on this new responsibility, but the system's not getting her baby. So I was there most of the whole time we were in jail, and she was worried about the baby going to foster care and stuff like that. And I was like, well, I'll get out before you, because she was going to prison. And I was like, I'll take care of it. And that's one of our caregivers who was bunkmate from county jail, Wanda. Well, they're not getting married, but they're together, and her mother's still working, so she couldn't do it. So I was like, well, the system's not getting my grandchild. So that's why we took over. And that's a paternal grandmother in that case. What we found through our research is that babies were changing temporary caregivers more frequently than we expected. This leads to another ACE, like this disruption in primary caregiving is an ACE for a child. And how often were they experiencing that? Why? And what can we build into our program to support families to prevent these changes in caregiving? This is a very colorful chart. I will tell you that the more colors you see in the chart equal the number of caregivers that a child has. And you can see at intake, we've got two colors. We've got the first caregiver, and we have the mothers who were released before they gave birth. And then by 3 months, we've got more colors on that chart. We've got a purple, which means that by 3 months, that child is already on their third caregiver. We have the red, which is by 3 months, the child has a second caregiver. And then if we go all the way over to 12 months, it's much more colorful than we'd like. We've got mother, we've got shared care, we've got first caregiver, we've got a bigger chunk of second caregivers, we've got third caregiver, and unfortunately, a child who is deceased. We've had one infant in our program who died. These charts talk about the kind of placement from birth, and we begin to see what kinds of caregiving arrangements seem to be the most stable. And what we have noticed is that grandparents are the most stable placement, and this makes sense. Other maternal kin and fathers have been fairly stable, even though there's a very small number of them. And then non-kin, we start to see some more numbers there. And what this tells us, we start to look at why these children were moved. As some of the folks at DFACS told me when I made those initial inquiries, is like, they don't start with us, but we're suspicious that they end up with us. 3 of these 10 children at this point were removed to child welfare, informally moved. Mom was unable to care for the infant, even though the mom had the baby when she got out before she had the baby. moved to another grandparent after the first grandparent died, moved to another foster family. And that's, again, from second to third caregiver is the next chart. All of this research, and the bottom line is that what our researchers showed is significantly statistically significant is that compared to children placed with non-caregivers, the children who are placed with a family member have a more stable caregiving relationship than either non-kin or foster care. And so when we have family caregivers who are capable, who are loving, and the child is safe and want to take care of the child, we need to be pouring resources into those families to protect the child, because that is the most stable placement, the one where they are most likely to stop the ACEs accumulation at birth. And instead, what most of these families have received in the past is absolutely nothing, no support. We are the organization that enrolls these children in Medicaid. We enroll them in WIC. We enroll them in SNAP. Before we started, these families often did not even know that they qualified, and they weren't even getting the most basic supports that they were eligible to receive. So we should be pouring more resources into these families, not just because the caregivers need it, but because we believe, and the evidence is showing, that's really protective for some of the most vulnerable kids in Georgia. Motherhood Beyond Bars, the name of the organization. I have left time for questions. No one interrupted me in the middle, so hopefully we have some questions at the end. And a couple of things I want to point out, like pitches. We have a website. It's motherhoodbeyond.org. You can go on there. The contact form on that website comes to me, but my email is Amy, AMY, at motherhoodbeyond.org. And we have an Instagram page, which a lot of updates get put there. So please follow us on Instagram. I always like doing this because then I do look to see if we've gotten follows after these things. And we have a Facebook for people who are old like me and are still on there. It's usually the same information. And our job is to connect our families to local resources. And I know that so many people on this call are doing amazing work throughout the state. So please let me know if you have programs that you think our families would benefit from, so that we can get them in touch with other sources of support. And so, yeah, I'm happy to answer questions.
We have a couple, but thank you so much, Amy. And if you guys don't feel compelled after this to know more or seek more, reach out, or at least follow on Instagram, then, I don't know what will do it, but so compelling. Thank you. I think this is often a group missed in our discussions when we're talking about child welfare and supporting families. And we certainly believe that through concrete supports and resources, we can prevent much families coming into contact with DFACs and foster care, just as your examples are showing as well. So I want to go to, we had Jennifer put a question in there that was kind of a couple part question. So how long does the program assist mothers after giving birth? And then also wondering about, is there someone assessing the caregiver the child is going to before they go to the home? And then is there someone doing assessments about the home and safety and needs being met after the child goes to that caregiver?
Right. So one of the things that changed pretty quickly about our infant caregiver program is that we used to rely on kind of the hospital as the first form of contact with the caregiver, and the hospital giving them those boxes. And we quickly realized that if we weren't going into the prisons anymore, we could be on their email system and their phone system, and we could make contact with every pregnant woman that came into the system. She could tell us who she had identified as a caregiver. So we are not a baby placing agency. We are not going to find a caregiver for you. But most of our moms have someone in mind. And then she tells us how to get in touch with the caregiver, and we can make contact with the caregiver long before the baby is born, which gives us a chance to do these sorts of needs assessments. So we're not going into the home as kind of our first introduction and like checking off that things, that the outlets are covered. But we are asking, do you have a way to get the baby home from the hospital? Do you have a car seat? And if the answer is no, we send you a car seat. We make sure that everyone has a safe place for the baby to sleep. I'm so thrilled to be part of the Safe Sleep program with the Department of Public Health. So we're now able just to actually send them a pack and play. They also get kind of a small, more portable crib. So we make sure that the infant has a safe place to sleep. And then as we are building relationships with that family, we do home visits. We do identify issues. Of course, we are mandatory reporters. And if we see things that we think are unsafe, or the child is being neglected or abused, we will make those sorts of calls. We have made 2 ever since we've done this. And we take that role pretty seriously. But our needs assessment is in conversation with the caregivers, usually before the birth of the baby. And sometimes we're able to have a discussion with the caregiver and they realize, like, I cannot do this. We need to find someone else. And instead of the baby being a couple of days old and trying to figure that out, we're doing it on the front end. I'll mention that we also are thrilled to work with DECAL to identify that every single one of our infants qualifies for early Head Start based on the McKinney-Vento definition of homelessness. And so when we started our research, this is just one of the ways the research points us in the direction we are supposed to go. We had 40 infants at that point, not a single one of them was in childcare. And so we recognized that put a huge strain on our families. We were able to identify that, yes, they qualify for early Head Start, and we're able to negotiate and often sometimes just sweet talk early Head Start centers into getting our program, our infants in as early as, I think it's 6 or 8 weeks, which is a game changer for our families. So we are really helping to identify solutions that would make caregiver choice easier to make. And then we start working with women, and we do not have a cutoff for our program. So we sure love it when these babies get diaper trained, like out of diapers, because that gets a lot cheaper for us. But the next one has come along by then. We spend about $40,000 on diapers every year. And right now we do not have a program with Kimberly-Clark or Pampers or anyone. We are buying them from Costco, and we are paying full price, and we are sending them to the doorstep. So if anyone's got friends at Kimberly-Clark or Pampers and wants to introduce me, I will take that introduction happily. Yeah, but we don't.
Put it out there, yes.
Mothers stay in our program until they don't need us anymore.
Awesome. It's good. So good to hear that you're removing all the barriers to, having those attachments and making those bonds strong, and having caregiver, especially for childcare, which is such a huge burden and lift, so that people can stay employed and keep going in that if they are a caregiver. I have a couple.
Stop my share so I can see more people.
Talking about, do you recruit volunteers, or are there opportunities for that?
Volunteer, I've been working on that for a while. When we were going into prisons, it was impossible. Couldn't bring volunteers in with you. And then when we started making contacts with our families, what we realized is, if Vanessa was the person they were used to talking to, they really wanted to talk to Vanessa. They didn't want to talk to me. They didn't want to talk to another staff member. In a pinch, we would do. And so putting people in contact who are volunteers with our families didn't seem like a good way to build the straightest line to building the relationships there. Our families live all over the state. And so, in situations like this, where there are people who live all over the state, that might be helpful, because most of our staff lives in Atlanta, and we will tour the state and try to combine home visits. But if there are people that live outside of the Atlanta area and are interested in doing like donation drives or things like that, that would be helpful. I'm consistently contacted by people who are very moved by what we do, and want to be very engaged and be helpful with the population. I'm struggling with figuring out how to do it in a way that both kind of protects the relationship we build with families and provides, and also, for a lot of you all probably work with volunteers. So I'm like, volunteers are hard work. And so we've got our hands full at the moment with the families that we serve, who are also hard work. And I want to build up the right structure so volunteers don't get, disappointed or frustrated with us because we're hard to wrangle.
No, I definitely understand and feel that. I know we have a lot of CASA people on who have built this very elaborate, beautiful system, and how much it takes to get there as well, so you can have consistent relationships with these moms. So I'm hearing, community drives for supplies, goods, diapers to help you guys out, especially ones that they can lead on their own. And the goods go directly to you is kind of the biggest one. that I'm hearing, and I know we have a lot of community members out there who are looking to do things like that and have them go to good places.
We also, on our Instagram page, we have like an Amazon wish list in the links that for the things that often go into those baby boxes. So you can always just, buy a pack of onesies, and they go directly into those begin boxes that go home with the babies. Everything that's in the begin box is brand new. That's kind of our introduction to the program. We want those caregivers and babies to be wowed by what they see in there. And the boxes are like so beautifully curated and gorgeous. And they signal like, this is an important part of you are an important member of our community. And we are glad you are here. So we always use new items. And after that, we start sending them hand-me-downs.
Yeah. Serving people with dignity and in a way that doesn't connote this as a service or a system.
Right.
I have Bridget Redajak wanting to incorporate some Learn the Science Act early materials into those begin boxes.
That'd be great. That's a great opportunity for us to get materials to people.
So Pamela has a question about the number of students in Georgia that do not have it noted that a parent is incarcerated. Do you have contacts that may have this information? So how would it be noted to a teacher or a system, or is it always?
It would, there's no tracking for that. We have a relationship with an organization called Forever Family in Georgia, which often works with older children who have an incarcerated parent and that provide a lot of supports and visitation. They do buses to the prisons for visitation. I should point out, visitation is always the least likely form of communication between a parent and a child. It's very rare that children get to visit. And for 2.5 years during COVID, there was no opportunity to do that. So it would really be up to every family to self-identify themselves as a family that's impacted by parental incarceration. There's no database, especially with no child welfare involvement, that would not be noted anywhere.
So it might be self-disclosure on the caregiver's behalf or something like that.
Yep.
Is there any legislative support for the state to provide any of these services or to directly fund some of the programs or even the diapers? Or is there anything being proposed or in the works that you know
of? Well, one thing I will, and I am so grateful to the Department of Behavioral Health and Developmental Disabilities, a state agency that supports certified peer specialists and forensic peer mentors. So 2 members of my staff are completely supported by a grant for certified peer specialists and forensic peer mentors. And we are hoping to expand the number of staff members in that category, not only because they are grant funded, but because they are the most effective ambassadors to our families, the people who can say, I have been through this, I'm on the other side, take my hand, let's go there together. Those are the people that are building the relationships. So that is a government agency that supports us right now. It's brand new. That grant started in October and it's life-changing for us. Before that, all of our funding came from individuals and small family foundations. So we're small but mighty and interested in growing. The other things right now, there's no legislation other than the anti-shackling legislation that kind of impacts our families. There has been legislation that would resolve the diaper tax on diapers. That has come up last year. I think it's coming up again this year. That would affect us. What I am working on kind of outside of the legislature, more in policy, is the identification of women in jails who we can divert from the prison system. I mean, that is kind of my number one. When you do this work long enough and you hear stories of people like Drew and people like that we work with every day who we know would be better served in a treatment program, it really lights a fire to figure out how we can make that happen. And so while we have been talking, I have been getting phone calls from Fulton County Jail. We are going to start going in there and doing a childbirth education class. But I've been very, very honest with the sheriff there that my goal is to identify women who we can divert. Because if we find out they are there and we do the legwork to connect them with their public defender and to come up with an alternative, And we have done this in the past. And every time we have done this in the past, we've been successful. You come as a unified front in front of a judge with your public defender and the district attorney, and we all say, this would be a better outcome for this mom and this child. Let's send her to Hope House. Let's send her to Mary Hall Freedom. Every time we've done that, the judge has said yes. And the outcomes have been overwhelmingly positive. The problem is we just can't find them. And so going into the jails, if you have relationships with jails, this would be a huge ask. If in your work you have relationships with jails, you have a relationship with a sheriff who would be willing to share information about who is incarcerated and pregnant in the county jail and work on a diversion project. I've got a team of students at Georgia State that just started a couple of weeks ago to build out a diversion project. And we're looking for 3 beta sites. Fulton County will be 1, but we need 2 more. So that's a huge ask for those folks around the state who may have those relationships.
Yeah. Is there any opportunity for diversion pre-sentencing?
Yep, that's what we're hoping to do.
Okay.
In the jails is all pre-sentencing.
Okay.
So if they're in jails, they haven't stood in front of that judge yet, for the most part. And that's when we would want to divert them, because once they get to prison, all I can do is support the family. I can't get them out. I can't get them into a program unless we work with pardon and parole, which is another option. So really finding them before they get sentenced is the key to diverting them. Oh, I see a Henry County Jail psychiatrist. That's awesome. Let's talk.
And I think you already mentioned that you serve families, you serve facilities outside of Atlanta. We serve families certainly outside of Atlanta.
Yeah, because in the Georgia prison system, all women are held in one facility in Georgia. It does not matter what county jail they came from. They all go to the same prison in Atlanta. And then the caregivers come to Atlanta to pick up the baby, but then spread out statewide and sometimes outside of the state. That's rare. Oh yes, the infant toddler court program. I'm aware of that. And I'm on one of the committees for that. I think there's a meeting tomorrow I was part of that 3-day launch last year. Excited about that.
I'm seeing some of the questions we've already answered since the start of questions.
I can go from the bottom. I see there's a question about breast milk. There's no program like that in Georgia. There is a program that does that in Alabama, and that's been up and going for about 5 years. I am hopeful that the prison system will think about how to do that. They've got a lot on their plate right now with the closure of Lee Arundel and movement to McRae. I think they can't really wrap their heads around how that might work, but they've been fairly unwilling to figure out how to wrap their heads around it in the last 5 years. So we've been kind of thinking about that.
Hopefully diversion will fit into some of that plan as well. So is the lever for getting allowing breast milk to be expressed and given to the baby, is that something that is policy at the state level or just kind of practice within the system?
I just got distracted by a question that I want to answer, but the breast milk, I mean, there's a lot of logistics in that. So who ships the breast milk out? How is it stored? You know, how do women get moved in to express? How often? The level of staffing in order to make that happen safely. It's just a lot of logistics. I saw the question about when you stand in front of the judge and it is agreed for treatment versus further incarceration, who pays the initial fees and weekly fees? Yes. So the programs that we've been working with, Mary Hall Freedom, Hope House, and Augusta, are grant funded, often by federal grants. Mary Hall Freedom Village has a SAMHSA grant specifically for pregnant and postpartum women. And so there are no fees for that program for the women. The same is true for Hope House. So initially we are looking for programs that are grant funded and low or no cost to the women who are coming in. I know that there are not enough beds to solve the problem for every, potentially every woman that's in a jail. and we will jump off that large bridge when we get to it. So, but right now there are programs that are no or low fee. And McRae, yes, McRae was a private prison that the Department of Corrections purchased many years ago. And Lee Arundel is slated to close everything. They're not closing up the entire prison. In fact, we think postpartum women will probably stay at Lee Arundel, but most of the women at Lee Arundel will move to McRae, and the timeline is still unclear. But Lee Arundel is falling to pieces. They have not had warm water, I think, in I talked to someone, it's been like a week. It's really that the facility itself is in terrible condition. Offer education caregivers, first-time caregivers, such as safe sleep. Yes, we build in, that's part of our education to caregivers, and our needs assessment is talking about safe sleep. We put the Department of Public Health information from the Safe Sleep program goes into all of the infant boxes, also the onesie that's like sleep on my back onesie. We're checking in with them at intake when we do these interviews. Our interviews cover safe sleep. They also cover pediatrician visits. We're getting updates. We're knowing whether the infants or they're having a hard time accessing pediatric care in those first few months. We're able to get them to, and sometimes this lack of guardianship is a real problem for having the child get to a pediatrician. They don't have any legal paperwork that they're allowed to take the child. So we have to smooth that over a lot of times. But we try to get as much information as possible to the caregivers about safe sleep. I'm also really, we were selected as a State of Hope site through DFACS this year. And one of the things that I asked for in that funding was infant development kits, which I think are like, have you all seen these at Target, the Love Every boxes? I love these things. They are so fancy. And I have been wanting to try to get them to our caregivers. They are infant development toolkits, like packaged as toys, with also instructions. And so we're going to do a beta test with about 10 families, delivering these Love Every boxes, playing together. It's like play therapy and attachment therapy with the families as a way of kind of a low judgment education session where we actually watch caregivers and infants play together. And we know that that attachment and that safe attachment to a trusted adult is one of the primary resiliency factors for ACEs, which our kids have. So I'm excited about the opportunity to do that sort of education.
I see, Joel, you came on camera and you're from the Family Connection and Telfair. Did you want to add something in there for that connection?
Oh, we can't hear you.
Yeah, I was muted. I'm sending Amy an email right now.
Oh, great.
I'm in Telfair County, which is McRae, and we're a small rural community. So if you need help making connections, what I was saying is that I can probably help you make those connections. We all know each other and we're probably related too. So
that's awesome. Thank you very much, Joel. I'll look for your email.
Love it when it works like that.
I do.
Thank you so much for coming on and sending that email.
All right.
Any other questions? Mostly I'm just seeing just everyone so thankful for this information. I see Ashley, you're off mute. Go ahead. One more second. Okay, Ashley, feel free to come back off mute, but I'm going to go ahead and put the evaluation link in the chat box for those of you who have to go ahead and sign off. I think we'll give a couple more minutes just for questions if anyone wants to come off mute or put them in the chat box.
Yeah, I'm happy to stick around. I can hear my mom's like chat with her friend in there. All is well. We've made it through. We have made it through without someone falling or yelling for help. I'm very grateful. Very grateful.
Hi, Amy.
Hello.
I just wanted to say thank you so much. This is so moving and compelling, as you all have, stated before. As you were, presenting to us and I was listening to what you were saying, the question came up, I wonder why, this is, such an area of passion for her. And then you went into sharing the story. And I believe that that's how we identify our calling, the things that are important to us and what we should be missioned to do is in that same fashion. And I just appreciate your time today and just sharing that with us. It gave a deeper understanding into what, women go through in another area now. So thank you.
Thank you. That's thoughtful and meaningful for you to share. Thank you.
Yeah, I see another request for the email. I'm going to repost it in the chat box with the website as well.
And I did see someone ask about the slides. Yep. My only question is the research team at Harvard has asked us not to publish the data quite yet. So the slides may have like a narrowed down version of some of what our research outcomes are. Probably just those slides with all of the colors on them missing. But yeah, we'll be able to share. And also I think the video from this will be available.
It's the contact information.
I see a question, are caregivers mandated to any kind of in-service childcare programs? No, they are not. There's no, unless there's an open a CPS case that's open for that family already, it would kind of be, and make the analogy often, like if I were leaving, I had a job that had me going out of town for a year. And I wanted my mom to be the caregiver for my child, I would just sign a power of attorney or limited guardianship paperwork. And I would not expect that, child welfare services would be poking around. So that is a very similar situation to what our moms are looking at, especially if there's no prior systems involvement.
And I will be posting the recording of this webinar by tomorrow morning on our webinar website and the slides by then or shortly thereafter then. I'm going to put Motherhood Beyond website in the chat box one more time. And I want to let everyone know about our additional upcoming webinars that we have. On February 28th, we are doing Harnessing the Power of Parent Leadership, since February is Parent Leadership Month. So we will be presenting that. So go ahead and register while you're on the website as well. I think we've got all the questions, but I really appreciate your time, Amy. We're thinking of your mom. I'm glad that she made it through and seemed to be doing well. And just for everyone who has listened, I feel like this is the type of information you can't unhear. So to share it with someone else and to follow them online, and anything else you can connect her with, as she's mentioned, please do so. But we appreciate you all for being here today and hearing this important information. Thank you so much, Amy.
Oh, thank you, Jill, and Prevent Child Abuse Georgia, and for the people on here who I know are doing tremendously important work throughout the state. I'm grateful for you all.
We'll see you next time, everyone. Have a good one.